Good morning, my respected judges and dear colleagues. Myself, Dr. Shanchari Sharkar, presenting before you effect of ethambutol on retinal nerve fiber layer thickness and central macular thickness. As we all know, ethambutol has been extensively used as a first line as well as second line anti-tubercular drug, and this usage has been associated with a sight-threatening side effect known as ethambutol-induced optic neuropathy. The tests used to diagnose the early changes of subclinical toxicity include visual acuity, color vision, visual fields, VEP, retinal nerve fiber layer thickness assessment by OCT. The purpose of our study was to determine the changes in RNFL thickness and central macular thickness due to this optic neuropathy in patients receiving anti-tubercular treatment to help in early detection of the toxicity. It was an observational descriptive prospective cohort study conducted in the Department of Ophthalmology and Respiratory Medicine of a tertiary care hospital for a duration of 1 year after taking proper ethical committee clearance. Patients who met the inclusion criteria were referred by the Department of Respiratory Medicine to our OPD for enrollment after taking informed consent. For all the patients, we conducted a routine ophthalmic screening comprising visual acuity, color vision, pupillary reaction assessment, fundus evaluation, RNFL thickness, and CMT measurement using OCT. This workup was done at the first visit, that is before starting the drugs, then repeated at second visit, that is after 2 months, and at third visit, that is after 4 months. The patients and their relatives were counseled in details regarding the signs and symptoms of the toxicity to ensure their safety and also to improve adherence to the study. We had no financial interest. Total 22 patients were selected for the study, among which 12 were male and 10 were female, with a mean age of around 34.5 years. All the patients to start with had normal vision of 6 by 6 on Snell's chart. This table shows the baseline values of various variables at presentation, like the visual acuity, the central macular thickness, and the mean RNFL thickness quadrant-wise. Here we can see the progressively decreasing trend of the mean quadrantic RNFL thickness for all the quadrants over the 4 months. Here we can see the central macular thickness have increased progressively with time. This slide shows a OCT report of a patient showing RNFL thickness before and after 4 months. And here also we can see the same pattern, that is a decrease in thickness in all the quadrants. Here we can see that the central macular thickness has increased compared to the baseline. Tafner et al. In a previous study found that 2-month standard treatment and 9 to 12-month extended treatment led to a significant reduction in the RNFL. Similarly, in our study also, statistically significant RNFL thinning was noted in all the quadrants at the end of 4 months. While thinning in nasal quadrant was significant throughout the study, in other quadrants, the thinning was significant only during the first 2 months, that is the intensive phase. Lee et al. Found a significant difference in average and all quadrants macular GCIPL thickness between the control group and the optic neuropathy group. In our study, the central macular thickness increased significantly at the end of 4 months. We may conclude that ethambutol has deleterious effect on optic nerve as well as macular region as evident from this study. Early and regular screening of the patients undergoing anti-tubercular therapy containing ethambutol with OCT seems to be an effective endeavor which can help us in early detection of the subclinical toxicity. We have to be more careful about starting ethambutol in patients with pre-existing macular edema, macular disease, or in people who have an increased propensity for macular edema. Thank you.
What is the minimum dosage of ethambutol where you expect this toxicity?
Sorry, sir, I couldn't.
What is the dosage of ethambutol where you expect this toxicity?
Actually, for this paper, we did not correlate with the dosage, but it can be even seen in 15 mg per kg, as low as 15 mg per kg per day. Even in that cases, we can, according to the previous studies, we can see incidence of optic neuropathy.
Your OCT picture was showing some white quadrants there. What does that mean? After 4 months, you showed that there is some decrease in RNFL, but 2 quadrants were white in color.
Sir, in the
Yes, your quadrantic map was showing that. So, what do you infer from that? Okay.
How do you explain the macular toxicity of ethambutol?
Ma'am, actually, this result was even surprising for us because in the previous studies, mainly in the macular part, we have noted that there is a reduction with time. But in this, though it was a short, the sample size was not very big. It was only 22 patients, so 44 eyes. But we noted the difference was, we noted an increase in central macular thickness. We are not sure what is the reason, because actually previous studies did not find such finding. But it was clinically insignificant, but statistically there was a slight increase in central macular thickness that we don't know how to explain.
It's not a measurement bias, huh? RNFL.
Yeah, measurement bias is possible. Has the same person taken the OCT of all these patients repeatedly?
Thank you.
Okay.